Well, this is a healthcare conference, not a venture capital conference, and I'm going to take you all for a trip to my dentist. Well, you wonder what I'm talking about. Let's put it this way. It could be as painful as my dentist, who's actually a very good guy. And we're going to talk about metrics. Doesn't that excite you? It's all about measuring that customer experience. And in this case, in the healthcare case, it's a patient or a resident. And we're going to talk about some new techniques that I've been involved in. I don't pretend to be the author. There are other politicians that take that credit. I'm just simply going to talk about what our foundation developed in 2013. But just a moment about me. I'll really put you to sleep this way. I'm an ex-entrepreneur, as I mentioned. Founded a company in online banking in 1989. So we predated the commercialization of online banking. We ended up with 2,000 banks, 2,000 billers. We were into 15% of the U.S. households. And you never heard of us because we let the bank take the credit. We did everything for them. We were an outsourcer. And that led to a big act of contrition, which is I got out of trying to make money and into giving it away. And we founded SECA Foundation. My wife, Rosemary's out there. She gets half of the blame, the good part of the blame. Ceca is short for Celebrating Caregivers. So you took the Ceca, Celebrating Caregivers. And we go into nursing homes and hospitals, and we arm their employees, and we call all employees caregivers. So if you're pushing a broom, or you're some fancy physician, and we have some really good ones that deserve all the credit in the world. They save lives, but we also have a lot of small people. It takes a team to work in a cohesive fashion to make that customer or that patient experience a really good one. So we go into these nursing homes and hospitals and long-term care facilities of all sorts, CCRCs, whatnot. If there's a community, the employees recognize each other for outstanding acts of care. So if I were to see Rosemary, let's say she's in the kitchen and she cooks a great meatloaf, and it's maybe some strange concoction that she developed for this certain resident. I might see that and then recognize that small act of care for that resident or patient. That's what we're after, is that small thing many, many times, but also the heroic stuff. Okay, let me just, that's pretty much my background, and I'm now working to get the next slide. And this is proving harder than, oh, that was my first act before, and then, okay, let's get this thing working here. There we go. Everybody know who this is? Come on. Mark Twain. Yeah. He looks like me, except he's got more hair. The bottom line is that Mark had a very interesting quote attributed to him. There are lies, there are damn lies, and statistics. We've all seen or heard this quote. Well, honestly, Mark Twain didn't say that. It's a white lie that he said it. And we're going to go through his quote, and I think you're hopefully out of this session coming away with some new angles on Mark Twain. Okay? Let's just start with statistics. Okay, here we go. Okay, you've all heard of HCAHPS? Can I assume that? So CMS, Medicare, basically does a survey. They have usually a professional do it, a surveyor. They ask a ton of questions. They get into the tiniest little part of that patient experience. And they're all good questions, but you come out of that exercise not really appreciating the bigger picture, I would maintain. So HCAPS, as you'll see, in my opinion, adds value. But what's missing is the bigger picture. And as I explained before, in the case of my former business in basically online banking and payments, we started out very early with a little system, Greenfield, and we had a little system here, and then we added something here over time, we evolved, and before you knew it, we had this complex system. And then you'd ask, well, are we serving our customers well? And we would come up, just like HCAPS, with all these statistics, and it never made any sense to me. That was me, and that was 10 years ago at least. Actually, that is a white lie. You can see my mask in the picture. The bottom line is that in healthcare, we're in a complex business. And you can't use too many statistics. They're valuable, but there's a bigger picture, and if you can drown in statistics. So, for example, the simple thing of checking into a hospital, and you're greeted by a receptionist who smiles and welcomes you. Well, that's darn important. Well, how does that compare to, say, that maintenance person that just happens to spend time in a resident's room? They haven't been visited by anybody, and they take the 5 minutes or 10 minutes to be a friend to that person. Now tell me which is more valuable. You can't weigh these things, let alone when that physician comes in and saves a life. So it's complex, and you can't think that out of this exercise of statistics, you're going to get to the right answer. Okay, so let's move on to damn lies. We've done the statistics. There is one potential damn lie is to seek simplicity. Now, to me, if you're looking to get rid of complication, then you seek simplicity. Obvious to do. So, okay, that's what we did at Ceca. We took this measure that many of you have heard about. Everybody heard of the Net Promoter Score? So if you don't know the Net Promoter Score, you probably know it when I tell you what it is. After you buy a product or service, you get nowadays drowned by companies, manufacturers, or service providers asking you, would you refer a friend or family member to buy this product or service? So that is called the Net Promoter Score question. A 10 is absolutely, I'd recommend this service. A 9 is almost perfect, okay? Those that rank you 9 and 10, those are called promoters, okay? If you're a 6 or less, that's a detractor. 6 is actually, I likely would, but I don't feel strongly. Well, the Net Promoter Score takes the difference between the promoters and the detractors. This is used in most consumer marketing businesses. It's not big in healthcare, but it is the way one measures that customer experience in non-healthcare businesses. Now, some healthcare communities do use this. I know Ascension was one. They were very big on it for a while, and then it kind of lost its energy. Well, we came up with a wrinkle here that in this whole Net Promoter Score that I think you're going to, it'll give you food for thought. Well, what is a good Net Promoter Score? If you take the difference between the promoters and the detractors, if you have a score of 30 or more, it's 100. You're doing a good job. You've got much more promoters than you have detractors. If you're less than 0 in that measure, you're not doing a good job. It's that simple. So let's take a look at how some. So you can see here, these are public information numbers. We researched them. They're not made up. Entrepreneurs like me sometimes there's a fine line. along with Mark Twain's lies and so forth. But you can see it kind of makes sense. Look at Amazon, they're 54. That's a service company. Look at Walmart, 23. They sell price. They don't sell the service. So it kind of falls into place. Looking at some of the very largest companies, and these are just large companies. So you can see Costco at 74. You can see USAA at 73. Those of you that shop at Costco or are clients of USAA know how much emphasis they put on honesty and service and so forth. But look at something that's really kind of curious here. Costco is 74, yet 25%, the top 25% or 72 are better. Well, the reason is that most of the best service providers are smaller companies. And that's intuitive. It's less complex. You can control more. So in all due deference to poor Costco and USAA, they're doing a really good idea, but they're not the tops in the country. Now this is very interesting. Here are Net Promoter Scores by industry. And this one surprised me, is that education and training was the tops. That just surprised me. I guess I was complaining. I'm 73 now, still complaining about my college tuition. You can just go on down there. Consulting's 51. Look at who's last. I don't know if you can see it out there. The bottom one. Healthcare. Healthcare is at the bottom. I didn't make this up. Now, to give ourselves credit, it's really been improving. If I could show a chart by industry, I'd show that. But I know enough about the business that though it's last, it's moving up. And it's because of conferences like this and focus on the customer, which is a patient or a long-term resident, and finding ways to get a better experience. Now, just very briefly, in SECA Foundation, what we do is we have these smartphones. If I were to recognize John back there for something, I'd go to this list. It's just like you're on a social platform. You just point your finger at the name and make nominate him for the SECA award. Then there's a second step. There's a 3-person panel, and on the panel is the CEO of the facility. If you're a CEO of a facility or a company, and you're recognizing, your biggest takeaway is, I hope you're out in front, symbolically, if not actually, of any kind of recognition. We insist. We won't do a partnership. We're a charity, public charity. We have a little fee, but we subsidize most of the fee, and we won't take on a partner unless their CEO or COO or top person, whatever you want to call the person, sits on that panel to select the honoree each month or quarterly or small facilities, month or the large facilities. We've got this down so it's 15 minutes. We've learned how to sift through some of the using AI and all the stuff that VCs talk about. Then there's the ceremony, and in this case, it's a hospital. You'd love to have everybody at the ceremony. It builds teamwork, but unfortunately in hospitals, you can't do that. So this is just a pod, and we have a lot of fun. There's balloons, sometimes cake. It's 15 minutes, it's not much. And we use a big check, and we're always very truthful, and we tell them right there not to put it into an ATM machine. It doesn't work as well as their card, but we do deliver a check. And what's amazing about this, and we tested various levels, 250 and 1,000, we did less, and we ended up at 250. It was a nice compromise. About a third of healthcare workers in our program get recognized for the SECA award. And those people are many, many times in support roles, and they're one check away from being thrown out of their house. That 250 is a lot to them. On the flip side, if you're a nurse and you've got a good paying job and deserve a good paying job for sure, it doesn't mean as much, but it still means something to them because it's not about that check as it turns out. It's about the recognition. And believe me, we've been operating now since 2013, 8 years. We've had over 30,000 of caregivers have been recognized. Over 1,000 SECA awards have been made. I go to a lot of these ceremonies, and there is not a wet eye at these ceremonies. Even though they might have been participating in the program for years, they are emotional, and they build team and a culture of working together, all focused on that patient. So the last leg here is we also, again, we're a technology-based foundation. We project all the nominees on web-enabled TVs in the lobbies or the emergency rooms or in high-profile places. And then we also show photos of the ceremonies. Well, this is 4 steps. Add a 0, it's really 40 steps. And that can't be measured very easily unless we had something fairly simple. So what we concluded in trying to evaluate how SECA was working was, well, we didn't want to hire a surveyor to go all the way out to the patients. Besides, our hospitals and nursing homes, the assisted living, the mental health, they did not want us, their partner, talking to their patients. So we developed the idea of, well, why don't we ask our employees, or their employees? So we would go to the hospital or the nursing home, and we would, once every 6 months, we would ask them the question, the Net Promoter question. Would you refer a family member or friend to this facility? And you know, it's very interesting. As you suspect, the costs of that are near 0. It's easy to benchmark this. And you know something? They're harder on themselves than the customers or the patients or the residents are. And if you look at Amazon there, they started experimenting with this a couple of years ago, and their employee Net Promoter Score is lower than the Net Promoter Score. So the employees see the sausage being made. You've got a credible source of feedback. So I'm not really just talking about healthcare facilities. I'm talking about you as entrepreneurs serving the healthcare industry. You have employees. Ask them the Net Promoter Score question. It's very easy. It doesn't cost anything. And it's also something that I'll talk about in a second, a very powerful tool for you. Well, we had all the quantitative feedback. The next question was, does it work qualitatively? So we took a sample of 11 of our facilities, and we said, okay, the ones that are circled, we think, judgment, we think that they're actually leading well and that they're involving their employees and recognizing them. So then we went back, and sure enough, the blue is a benchmark. The orange is what happened six months later. You can see we're pretty much right, but not perfect. So number 7, we missed that one. I don't know. I must have been asleep at the switch. But the point being, I was almost delighted with this result because if it had been perfect, then you probably want to doubt it. But the point being is that there's quantitative and qualitative, and it syncs when you use an E Net Promoter Score. Now, back to Mark. We've gone through statistics. We've gone through damn lies. Now we're at just the simple lie. Well, the truth is, patient satisfaction isn't the only part of patient experience. So as you all know, and it's intuitive, if you're not in a healthcare community yourself, you've all had children, had parents. It's more complicated than just the patient satisfaction. In fact, of course, there's the quality of care. You know, if if I'm perfectly satisfied, but later, 6 months later, find out a piece of gauze was left in there where the appendix used to be, that ain't good, okay? And then, of course, safety is huge. If something goes wrong, you're probably on a bad list with CMS or whoever your state regulator is. So patient experience is basically like a three-legged stool. So guess what? What I've been talking about is patient satisfaction, not those other two stools or legs of the stool. So indeed, we had to step back and say, okay, so we have this neat E Net Promoter Score, but that's not enough. We need to measure the turnover. The turnover, we correlate turnover not with just the cost of recruiting. It's new employees make errors. Until they're fully trained, they're risks to you as a healthcare provider. So we look at turnover rate as an indication of safety. And then we also look at, in terms of the quality of care, in caregiving, it's all about working as a team. Are you engaged? So we measure engagement. Are they participating in our program? We measure all unique nominations. We look at how many times a year somebody gets recognized. That's all in here. And I wanted to make sure that all these lines were pointing in the right direction for you guys, but it actually matches the last year experience. So it is working for us, not perfectly, but nonetheless, it's working, and we're happy with it. So back to seek simplicity, that simple kind of thing to manage complexity. Well, then reject it. I told you I'm crazy. It is counterintuitive, I realize, to get up here and talk about, hey, there's this mess of data out there. You've got to glean something from it, not get too micro. And I tell you to seek simplicity, then I turn around and say, then reject it. But that's part of leadership. If these things are not completely simple, and indeed, if you really step back at what I've been trying to say, it is first, healthcare in particular it's a lot of businesses, but healthcare in particular is a three-legged stool. You can't maximize patient satisfaction at the expense of safety or quality. So don't get too enamored with the E Net Promoter Score, because it might be a bigger experience that you have to measure. The second thing is the E Net Promoter Score is great for you as leaders. It's wonderful. When we do it at Ceca, when I was with this other company that I founded in banking, we did the same kind of thing. And we would post that E Net Promoter Score and say it was 19. We'd post it. Everybody had to see it. And then I'd say, we need to get to 25 in 6 months. And if we got to 25, great. If we didn't, they all knew that customer-focused number of 25, or whatever it was at that time, we either achieved something or we didn't. And then, of course, you want to go, okay, you did 25, let's go to 30. So make sure you promulgate this score, because it's something that your employees can all focus on, which really, what it amounts to is focusing on the patient or the resident or your employee if you're not a healthcare provider. Last but not least, the E Net Promoter Score it's not enough. It's almost like with it, it's the sound of one hand clapping. You need two hands. So I'm not here to say that surveys or CMS is all wet. Not at all. You need them. They will help you diagnose the different elements involved in that patient experience. But don't stop there. You got to go to a higher level and make sense of it. And that's what the E Net Promoter Score really gets at. So one final thing out of Mark. This is profound. The secret is getting ahead. To getting ahead is getting started. Just do it. Just do it. Try it. It doesn't cost you anything. I think your employees are going to like it. think you get good data, whether you're a healthcare provider or somebody providing to the healthcare community. Try it. And if it doesn't work, it doesn't work. You haven't lost all that much at all. On the flip side, you have a complete solution here. You will have the microdata that'll tell you something about diagnosing how you can get better or why you're doing so poorly, but you'll also have something that gives you an overview. Thanks very much. You've been great at listening.